This is a video narration of the first chapter of Natural Relief for Anxiety and Stress by Gustavo Kinrys, MD, and Alexandra Gold, MA. We live in a society that sells a pill each time we are the least bit uncomfortable. Therefore, it is not unusual that patients in chemical dependency treatment centers arrive there already addicted to all kinds of pills. One fairly common class of medications is those prescribed to treat anxiety symptoms. Although medication can help reduce anxiety symptoms, it comes at a cost. Many of the medications used to treat anxiety symptoms are addictive. Let's use Xanax, a common anti-anxiety medication, as an example. The generic name for Xanax is alprazolam and it is classified as a benzodiazepine tranquilizer, a central nervous system depressant that can be addictive, and drug withdrawal symptoms may develop if you stop taking it after only 4 weeks of regular use. Also, anxiety medications do not fix anxiety problems, they simply manage the symptoms of it temporarily. Some patients who are prescribed medications for anxiety become addicted to those medications and eventually find themselves in treatment, perhaps even for an addiction to another substance. While in treatment, the staff has the following choices in helping to reduce the patient's/client's anxiety. 1. Continue the patient's anxiety-reducing medication. Of course, the patient is already familiar with that drug and may experience less anxiety staying on it than when anticipating a change of medication. However, as one might guess, addictive medications are rarely continued once a patient enters chemical dependency treatment. They are also very risky to use when a patient is in recovery, since using these types of anxiety medications can significantly increase the risk for relapse to not only other anti-anxiety medications, but also other addictive substances, e.g., alcohol. 2. Switch to non-addictive medication. Giving a new patient a different medication which is non-addictive can ease the initial concern that they may experience in a treatment setting. A medication that will sometimes be prescribed is Vistaril, also known as hydroxyzine. Occasionally prescribed for allergy symptoms or nausea, hydroxyzine is an antihistamine with anxiety, muscle relaxing, anti-vomiting, bronchial dilation, pain relieving, and antispasmodic properties. Hydroxyzine has been used to treat a variety of problems including acute emotional problems, and anxiety associated with stomach and digestive disorders. Other non-addictive medications used for treating anxiety symptoms include Buspar and some antidepressants and beta blockers. As noted above, these medications generally do not cure the anxiety disorder but, instead, treat the symptoms associated with it. If a person with anxiety stops taking these medications, the anxiety symptoms often return. 3. Teach behavioral modification techniques. This strategy involves helping a patient learn to manage and reduce their anxiety symptoms by changing the way they think about those symptoms and how they react to them. A more comprehensive look at this strategy may be beneficial. First, it is imperative to validate the anxiety that the patient feels. The patient will not trust the clinician to offer solutions if the anxiety he or she feels is minimized or treated too casually by the clinician. Finding out how long the anxiety has been a problem and when it began may offer a therapeutic clue. Discovering the beginning of this problem may disclose an event or a trauma that has never been fully worked through. Helping the patient have a safe place to fully discuss this event or trauma can offer some resolution, helping to identify what kicked off a response that has now become problematic on its own. Helping the patient to identify how long the anxiety has occurred provides a chance for the clinician to offer comfort to the patient for how long he or she has suffered and attempted to deal with this condition. Education about addiction can be extremely important. For instance, many of the new patients in a drug-alcohol treatment facility do not yet realize that mounting anxiety can be one of the results of progressed addiction or detox. When addiction is the root cause of the anxiety, the condition tends to recede as withdrawal completes and the patient finds himself or herself in a safe and supportive environment. Offering the patient another word for anxiety can sometimes help. Replacing the medical or psychiatric term anxiety with fear can allow the patient to have a regular feeling word that begins to normalize the condition. Then, it may be easier for the patient to discuss what it feels like for him or her. Helping the patient discuss whether the things he or she fears are likely to occur may give him or her some perspective, even though the fear can nonetheless remain very strong at this point in therapy. It is helpful to give the patient permission to sit near an exit and be able to excuse himself or herself and leave the gathering if their fear mounts too greatly. This permission often reduces the fears sufficiently so that the person rarely leaves the group therapy or the treatment lectures after receiving permission to do so. In fact, it empowers the individual so much that often the patient will soon report he or she feels strong enough to move forward in the setting, abandoning their need to sit near the door. Teaching the patient positive self-talk can help. "This too shall pass" is an Alcoholics Anonymous slogan that has helped many people realize this awful feeling is not going to last forever. "God is bigger than my fear" is another statement that can become reality to the person if they repeat it often enough. A sturdy rubber band worn around the wrist has been known to have a calming effect on some anxious individuals. When first putting it on, the instructions can be simple. When you are tense or anxious, grasp this band and toy with it, placing your anxiety into the rubber band. A patient I worked with successfully completed treatment and, still sober, returned 3 months later to report to me that he hadn't taken off the rubber band, using it as a reminder that he doesn't have to be that anxious again. Helping the patient to be empowered is an important part of the clinician's task. Empowering the patient to learn to reach out and touch something real, such as the rubber band, or even the surface of one's desk, or the nearby tree while crossing campus, can help the individual make contact with something even more real than the feared feelings. It is not a surprise to the practiced clinician when the previously anxious patient approaches the clinician to report, "I've decided I don't need to take the Vistaril anymore. I am really doing fine on my own now." When the patient learns to manage his or her tension and anxiety, they may be able to deal with other life stressors without the need to resort to another drink or addictive drug. At this point, recovery has begun,